I'm Barbara Holloway. I'm a CRNA, Certified Registered Nurse Anesthetist, and I wanted to share a little bit more information regarding a career as a nurse anesthetist. In the earlier video of me, you saw me standing in front of an anesthesia machine in the operating room. I want to share with you the vital responsibilities that I have each day when I take care of patients undergoing surgical procedures. First of all, every patient has to be evaluated before their procedure for drug allergies and any other medical problems that they may have that would interfere with the anesthesia drugs. My training has prepared me with a wealth of knowledge to be able to render to the patients a very complete physical, and also to determine what type of anesthetic would be best for their case. It's important to remember that the training for a nurse anesthetist is pretty intense. You begin your career as a BSN RN, and then you have to have 1 year of critical care experience before you can go to an anesthesia training program. Once you get into the training program, it takes 2 to 3 years to complete the training. The training involves taking courses in chemistry and physiology as well as pharmacology. Each day when I take care of patients, I evaluate and look at the patient's health history so that I can determine what drugs would be best to administer during anesthesia. It's good to remember that if you're going to do anesthesia, you need to remember that you need to have a good science-based background. First of all, when I evaluate patients, I'm looking for the types of drugs that they may be, medications that they may be on that may interfere with some of the anesthetic drugs that I'm giving. Also, during my evaluation, I look at their health history to see if there are any comorbidities or medical problems that would lend itself to be difficult in terms of the drugs being given. Remember too also that we as nurse anesthetists are in charge of monitoring the patient's vital signs throughout the procedure. When I bring a patient into the operating room, it is my responsibility to give the drugs, to administer the anesthesia that they will be rendered unconscious for the procedure. It is my responsibility during the case to monitor the patients closely, watching their vital signs, their oxygen levels, their blood pressure, and looking to see if there may be any complications with the surgical procedure. After the surgical procedure is completed, it is my responsibility to awaken the patient safely and to make sure that they have no perioperative or postoperative complications. I want to share with you that if you're interested in becoming a nurse anesthetist, it's important to know that you need to be preparing now by taking a lot of science courses, primarily chemistry, math, physiology, and anatomy courses. My training was pretty intense, but I can tell you that my training prepared me for this career very well. I take pride in knowing that each time I put a patient to sleep, I am giving them the best care that they can get with the knowledge that I have been given. Again, I want to let you know that if you're interested in a career in nurse anesthesia, go to aana.com and you will find all the necessary information to enroll in a nurse anesthesia program. Thank you again for letting me share part of what I do with you and your nursing school. Thank you.